Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn the list of anti-obesity drugs. So, in the anti-obesity drugs, there is a drug which is called as fenfluramine. This fenfluramine is 5-HT2C agonist. It is actually now banned. Why? Because the side effect of this is it causes pulmonary hypertension and cardiac valve malfunction, and as a result it is banned now. Okay, what are the other anti-obesity drugs which can be used? So the first drug is orlistat. Orlistat is the anti-obesity drug orlistat. Okay, orlistat is actually gastrointestinal lipase inhibitors. It will reduce the lipid absorption. But the problem of this orlistat, if you see side effect, it causes decreased absorption of fat soluble vitamins. It causes decreased absorption of fat soluble vitamins. It causes flatulence. It also causes fecal incontinence. Okay, this is about orlistat. Then if you see the next drug which is important is liraglutide. Liraglutide is actually GLP-1 agonist. And what does this do? This will decrease the appetite. And this includes nausea, vomiting, pancreatitis. This is nausea. The side effect, it causes nausea, vomiting and pancreatitis. Then we have lorcaserin. What does this lorcaserin causes? It is a 5-HT2C agonist. Okay, this lorcaserin will decrease the appetite. And the side effects of this lorcaserin is it causes headache, nausea, dizziness and constipation. Then the next important drug is naltrexone. Naltrexone or bupropion. Naltrexone is a opioid antagonist, whereas bupropion is an antidepressant. The mechanism of action is not known, but these will cause side effects like headache, nausea, dizziness and constipation. So these are the important anti-obesity drugs. Thank you for watching. One more drug, that is topiramate. If you see topiramate is an anti-seizure drug. It also causes weight loss. Side effect is insomnia, dizziness. It causes nausea. Then it causes paresthesias and dysgeusia. One more important drug is phentermine. This phentermine is a sympathomimetic. It is a sympathomimetic. It will produce norepinephrine release in CNS. Even this causes weight loss, has side effect. So the other side effects are increased BP, heart rate. It can cause arrhythmias, or it can result in insomnia and anxiety. So these are the important points about anti-obesity drugs. Thank you for watching.
Thank you and thank you for watching.